Fight back when pain keeps you from doing stuff. Hey everyone, this is Dr. Jeff Williams with Creekstone right here in Amarillo, Texas, and I'm coming to you again with a brand new video. And today we're talking about pain, something that affects nearly all of us around the world. I want you to make sure that you share this information with somebody that you care about, because this is important stuff. A lifetime of pain is no good. Now, pain can be a great equalizer. When the biggest, baddest athlete gets hurt, they're reduced to being just a regular human almost immediately. This doesn't even begin to approach the effect pain can have on regular folks like you and me, or grandparents, parents just making their way through life. Not only can it be frustrating, to say the least, but it can be life-changing. Not only can it be frustrating, to say the least, but it can be life-changing if we allow it to be. Pain can hurt physically, but pain can also affect us in a mental way. It can lead to depression, and it can cause us to withdraw from activities that we love and withdraw from our lives. The consequences of this behavior can be severe, and they can be concerning. Today, I want to give you some general ideas and thoughts concerning pain and things that we can all do to fight back against what can potentially be devastating effects. Let's start with bed rest versus movement. Now, years ago, it was normal for a healthcare professional to tell a patient that was suffering from back pain to just go home, take these muscle relaxers and painkillers, lay up in bed for a few days, and you'll be okay. Those days have fortunately gone the way of bloodletting, lobotomies, letting the spirits out, and using leeches. Think about when a patient has an appendectomy. Maybe they have their gallbladder removed, or maybe they had just given birth. Now, it sounds like torture, but the hospital staff has them up and walking the halls the very next day, sometimes even the very same night. Now, this is because movement is healing. They've shown through quality research that those going on bed rest or engaging in inactivity, those people are much slower to heal, and their ultimate healing is less robust or complete. On the other hand, those that engage in movement and activity as quickly as possible heal better, and they heal faster. For example, hurt workers don't like to hear this, but in general, the sooner a hurt worker can get back to work, even if it's on light duty, the sooner they get back, they heal better and they heal faster. Not only physically, but also mentally. Ultimately, it is best to move. Hurting on a significant level, that can be exhausting. It can be tiring. And it's okay to lay down or sit down and get some rest. Just don't stay there, okay? Get up and walk around the house. Walk to the mailbox or to the end of the driveway and back if that's all you can do. Maybe all you can do is stand in one spot and do hip circles clockwise and counterclockwise, or figure eights, or right to left, front to back, then go back to the circles. Maybe that's all you can accomplish, but at least you're moving. Whatever it may be that you can get done, get it done. You will feel better, you will heal faster, and you will heal more completely. Now, let's discuss hurt versus harm, okay? Sometimes, especially when you hurt, when you're just sitting there, right? You hurt doing nothing. Well, the thought of movement or exercising can be pretty daunting. Then, when you get to moving, it hurts, right? Well, this can absolutely kill your need to move. It will kill your initiative to move, right? And for that reason, there's a key concept here, and it's the concept called hurt versus harm. And we're doing something new, especially in an injured state. The things that we're going to be doing are typically going to hurt on some level. But that doesn't mean the hurt we feel is necessarily harmful. In fact, movement is rarely going to be harmful. It is important to separate the two, because hurt does not equal harm. And moving and exercising through the hurt is vital to recovery, allowing the hurt to prevent us from activity and movement leads to more profound fear avoidance, which can be a game changer for the worse. Now, since I mentioned it, let's dive in a little more on what is called fear avoidance. Let me explain it. Everything that we've talked about so far in this video previously, it has led us to the point of talking about fear avoidance. And fear avoidance is when pain sufferers begin avoiding activities that they love, activities that they enjoy, because they're afraid that those activities are going to hurt or aggravate their pain. And while we picture pain as something that affects us physically, once again, it can be as much a mental game as it is a physical one. There is even a fear avoidance model in the research literature, and it goes a long way toward explaining how some engage in the process of recovery. They continue their independence without negative thoughts about their pain. And this leads to acceptance of that pain and ultimately a faster recovery from the pain. On the other hand, it also explains how patients can slip into a downward spiral or a vicious downward cycle, if you will. That can be initiated when a patient misinterprets the pain and they catastrophize it. And that means that they make a bigger deal out of it than it really is. Now, this harmful or negative thought process about pain can lead to pain-related fear and behaviors that seek to keep the patient safe, which means they start avoiding things that they think may cause them harm or at least aggravate the pain. And I called it a downward spiral because avoiding activities that you love, that feed your soul, that leads to a loss of enjoyment in your life. That leads to depression. There is a clear link between chronic pain and depression and fear avoidance and loss of enjoyment. It all goes together. And not only that, but after a person slips into fear avoidance for just maybe 7 to 10 days, then they start to experience what is called deconditioning, which means they begin losing abilities. They lose strength and they lose conditioning. Conditioning that they enjoyed when they were pain-free. And it's hard to recondition something, but deconditioning can happen fairly quickly. Now, instead of simply having pain, once fear avoidance begins, a patient now has the pain, but they've also got loss of enjoyment, depression, increased pain, deconditioning, and a much longer recovery process. If a patient were not already in chronic pain, well, they certainly are now. Now, finally, since I just mentioned it, we're just leading one into the other, right? Let's briefly cover chronic pain and the sensitized central nervous system. Don't get scared, this is easy. Pain can turn chronic and much harder to treat after only 3 to 6 months. It's not very long. We always think our pain will just resolve and go away on its own. And for that reason, we put off getting any treatment for it. Then one day, we look up and we've been hurting for 3 to 6 months, and now it's chronic, and now it's much more difficult to treat and resolve. This is a huge, huge topic, chronic pain. It's well beyond the aim of this article, but in short, chronic pain is partly due to a sensitized or upregulated central nervous system or brain. The longer pain persists, the more of that pain will also begin to persist or live within the brain. The brain holds on to that pain to create your future pain experiences and also to prevent you from more pain by using your pain experiences as protection mechanisms. I'm starting to get a bit off into the weeds here, and I know that. So let me give you an example. The perfect example is the curious case of phantom limb pain. Okay, some people know what phantom limb pain is, some don't. I'm going to explain it. And if you don't know what it is, please Google it, because I think you'll be fascinated by it. But in short, it's when an amputee has an arm or a leg cut off, but they still experience pain in the limb that's gone now. How can a limb that no longer exists still hurt? Well, the explanation is really a pretty simple one. Part of the pain existed in the brain, at least as much, or maybe more, than actually existed at the site of the injury. The physical aspect of the injury was treated. In fact, it was completely cut off. That's treated. But the cognitive, central nervous system part of the pain wasn't treated at all. As a result, the patient's pain persists. This does not just happen in those that have an amputation, by the way. When a patient presents to the clinic and they've had that pain in their back or their neck for more than 3 to 6 months, part of that pain also persists simultaneously within the brain itself. I know it's a weird concept, but this is not chiropractic stuff. This is research pain neuroscience. Part of treating chronic pain like this that lives in the brain is through movement. Movement, even when it hurts, but not harmful, that kind of movement builds confidence. Confidence not only in a patient's current situation, but also in a patient's perception of their future and their future ability to be able to heal and to get out of pain and to move on beyond it. That is crucial to a patient being able to get better. Another aspect of treating pain that is also living in the brain is through cognitive behavioral therapy. CBT is now recommended as a first-line therapy for chronic back pain by the American College of Physicians, as is spinal manipulative therapy, exercise rehabilitation, acupuncture, heat, low-level laser, and massage. We're not licensed in in cognitive behavioral therapy, but we do have all of the other therapies mentioned available here at Creekstone. That's why I keep pointing at myself. We do all that other stuff. At the end of the day, pain can be conquered through determination, consistency, commitment, movement, and recognizing that long-lasting pain must be treated as much mentally as we treat it physically. All right, I'm Dr. Jeff Williams. I want to thank you for watching this video. If you're watching on YouTube, hit that subscribe and share this with someone that you care about. I promise they can do good with this. This is great information if you're a pain sufferer. If you're watching on Facebook, a like and a share and a comment are the coolest ways that you can help support evidence-based, patient-centered care while you share some useful information with those you care about. If you're from the Amarillo area or you're going to be passing through and you need to be treated, give us a call at 806-355-3000. Get on our schedule. I'd love to try to help you. Until next week, be safe, and we'll see you then.